Hi, everybody. I'd like to talk a little bit about hypertension, or high blood pressure as it's commonly known. I have been diagnosed with hypertension. I'm currently being treated for it. This is something that runs in my family. The black and white picture on the left, the gentleman on the left is my grandfather. He had hypertension and he died of a massive heart attack at the age of 53. The gentleman on the right is my father, who also died of a massive heart attack brought on by hypertension, and he was 60 years old. I feel that there needs to be better education on hypertension. It's not one of those diseases like HIV or AIDS that may have activist groups or have people that protest. So it often goes unnoticed by the general public until you or a family member might be diagnosed with it. Going to talk briefly about some statistics for our great Commonwealth of Pennsylvania and the city of Pittsburgh. Pennsylvania, out of 54 U.S. states and territories, is ranked number 19 when it comes to the number of adults with hypertension. And the city of Pittsburgh ranks number 6 out of all major U.S. cities for adults with hypertension. Let me backtrack just a second. Between this slide and the previous slide, and for our final, I have an animated video that I would include to give a brief overview of what happens to your blood vessels and heart when hypertension does exist. High risk. You are more likely to be told your blood pressure is too high as you get older. This is because your blood vessels become stiffer as you age. When that happens, your blood pressure goes up. High blood pressure increases your chances of having a stroke, heart attack, heart failure, kidney disease, or early death. And these are some of the high-risk groups. African Americans are at the top. If you're obese, if you're often stressed or anxious, drink too much alcohol, too much salt in your diet, a family history such as mine, if you're a diabetic, or if you smoke. Some symptoms. For most patients, high blood pressure is found when they visit their healthcare provider or have it checked elsewhere. Because normally there are no symptoms, people can develop heart disease and kidney problems without even knowing that they have high blood pressure. Some of the symptoms that I have there at the bottom: severe headache, nausea or vomiting, confusion, vision changes, or nosebleed. They can form into what's called malignant hypertension, which is an acute impairment of one or more organ systems, especially the central nervous system, cardiovascular system, and or the renal system. Here I'm showing you your normal blood pressure, as everybody probably knows, is 120/80. Hypertension is considered anything at or above 140/90, and you're the pre-hypertensive stage between 120/80 and 140/90. All adults should have their blood pressure checked every 1 to 2 years if their blood pressure was less than 120/80. If you have high blood pressure, diabetes, heart disease, kidney problems, you should have your blood pressure checked more often, obviously. And actually, blood pressure readings taken at home may be a better measure of your current blood pressure than those taken at your doctor's office, due to anxiety for being at the doctor's. I know personally that when I'm at home, my blood pressure is lower than when I'm at the doctor's. Treatment. Here's a list of some treatments. The goal of treatment, obviously, is to reduce your blood pressure so you have lower risk complications. You can do many things to help control your blood pressure, as I have listed here. Eating a healthy diet. One of the big ones is called the DASH diet, DASH, DASH, which stands for Dietary Approaches to Stop Hypertension. Exercise regularly. They recommend at least 30 minutes of aerobic exercise a day. Stop smoking, limit your alcohol intake, so on down the line. That kind of goes back to your high risk grouping. Here's a percentage of adults aged 20 years and older by state. You can see the different shades there and what they correspond with at the bottom. And some statistics. The 67 million Americans, that equals out to 1 in every 3 American adults. It leads to 348,000 American deaths every year. And so on down the line. How to prevent, reduce your average sodium intake. That if every American did that, reduce their sodium intake, that could drop the amount of Americans with hypertension by 11 million people. And the biggest statistic I want everybody to pay attention to is the one at the bottom. 1 in every 5 American adults with high blood pressure don't know they have it. So if you want to go back and take a look at our blog for the class and look at the blog roll, and using this statistic and combining it with our blog roll, like I said, 4 people on that blog roll have high blood pressure and are unaware of it, and it could be you.